rhyme, another rhythm for y'all to listen. I'm never quitting on my mission. I'ma roll with what I'm giving. Got some ambition, this new edition, filling positions. Looking at the void in myself and feeling what's missing. Better watch the way you going, better go in the right direction. In the moment you stressing, but you gon' be counting blessings. And I know that for certain. Keep on working, open curtains, haters swerving, cause they ain't ready for your final version. Whoa. I'm never gonna give up, fall down, I just gotta get up.
Good morning, everybody, and welcome to the welcome to the Tom Ficklin Show. Even though I might have a little cough or whatever, just to be human and be alive is a blessing. And we have some doctors on the show that can give me some primary care, some telehealth information. And I joke inside, but today's show is about diversity and equity in healthcare, and it's really about universal healthcare. How we all should be healthy. We all should have every right to the quality health care. And unfortunately, or whatever, for whatever reasons, on Monday, May 17th, we're still talking about diversity and equity in healthcare. But we have some folks on the call that will move us from just talking about it to just taking action, taking real policy, programmatic, curriculum, content, educational action, some real policy, world institutional action. So without building Dr. Ingenia Genoa up too much more, she's on the line with us. Dr. Ingenia Genoa is the Associate Professor of Medicine, General Medicine, and she's the Associate Chair for Diversity and Inclusion at the Yale Graduate Medical Education Director for, and she's also Director for Diversity, Equity, and Inclusion. Dr. Genoa, I'm not sure how many commas or hyphens we know, but basically in terms of making this a medical school education and the recruitment fair and equitable and actually transparent, you've been involved with that. So really welcome to the show. And we're joined by Reverend Dr. Leroy Odinga Perry Jr. and Reverend Elvin Clayton as well. And they are cultural ambassadors at the Yale Center for Clinical Investigation. And they've been kind enough to join me on several shows before. And these shows are really, we talk about take back your health. It's not, this is like just a routine moving our lips and trying to evoke some words. This is the real deal in terms of combating discrimination in healthcare and overcoming disparities, et cetera. So we're in these folks are in the trenches. They're in the trenches, they're on the ground, they're block by block, church by church. So let's listen in and tune in and really just welcome to both, all three of you for being on the show this morning. Dr. Janelle, I'm somewhat embarrassed, but I wanna, when I say embarrassed, I don't like to kind of give salute or pat you on the shoulder so early on the show, but rumor has it, and correct me if I'm wrong, but you recently received an award in 2021, the Herbert W. Nickens Minority and Representation in Medicine Award. And then back in December, you were a recipient of another award from the American College of Physicians. So I start off with that you're not just somebody that's been talking the talk, but you've been recognized for what you're up to, and you've been earning your salary. It seems to me. Is that fair to say?
That would be fair to say. Thank you very much.
So tell us a little bit about the work of, because we hear these terms equity, inclusion, just in general, but particularly when it pertains to healthcare. But these are not just buzzwords. These are substantive. These are marching orders when we say equity and inclusion in healthcare. So why is that so important to you?
So thank you for that important questions. To me, I feel that equity and inclusion and diversity is the responsibility of all of us because it is the right thing to do. But why it is so personal to me is because I have experienced personally inequities, racism, and exclusivity. So when I think of my patients who come from very similar backgrounds to mine, I see myself in my patients. And so I have no choice, but I have to do the work to eliminate racism and the inequities that we continue to face in 2021.
You know, oh, go ahead. I'm sorry.
No, I was going to say that that the care of the patients that we provide is very much impacted by these inequities. And so, as you were mentioning before, everyone has the right to health. And with these inequities, no one, particularly our patients, our minority patients, are at a major disadvantage.
And you mentioned the word eliminate, and some people would say, well, that's an the abolitionist strategy. I regret that we don't recognize it, that abolitionists, we need abolitionists today. So when you say eliminate that, my mind goes to this is the abolitionist strategy. So hats off to you. Again, and we're not just issuing press releases. Yale has recently announced the formation of a new Office of Diversity, Equity, and Inclusion in internal medicine. We can pretend that Yale's not one of the most influential institutions on the planet, but we are. So when Yale does this, this is important. This is important. So a new Office of Diversity, Equity, and Inclusion in internal medicine. And the internal medicine department has already been nationally recognized. So why is this needed now, and how does this impact the legacy in your opinion? I mean, this is pioneering.
So I have been at Yale for 15 years, actually got almost 16. And for the first 11 years, I was the medical director of the primary care center, the place that we provided primary care to our community. And for the last 4 years, I have been leading those efforts that you mentioned before in the Department of Medicine and also graduate medical education. We realize, we are the first to admit that yes, we have done a lot, but there's a lot more to do. And what this office in the Department of Medicine, what it's going to do is that it's going to create and lead an infrastructure that will reach across the department. For example, we collaborated with a consulting group called the Barthwell Group to create a strategic plan for the Department of Medicine to address diversity, equity, and inclusion. We came up with 5 goals and several objectives. And this office is going to be the instrument to implement the strategic plan. That is going to, as I said, go across the Department of Medicine. The Department of Medicine is the largest department in the School of Medicine. We have 11 sections, and each section is going to have a diversity, equity, and inclusion vice chief. And we're also going to appoint representatives from the staff to also join us in this effort. So the office is going to be the driver of all the diversity and inclusion efforts for the Department of Medicine. I think you're muted there.
I had to put myself on mute and close and go off video for a second because I think the lawnmowers in the area have been ramping up their engines, and so I apologize about that. No, I mean, where's your Dr. Janelle? Where's the cloud? If someone goes off the rails in terms of your directing and managing the initiative, where's the cloud or the importance or the influence? How do you kind of make sure that things get back on track?
So the beauty is that when I say the Office of Diversity and Inclusion in the Department of Medicine is actually has a larger umbrella, which is the School of Medicine and the university and the hospital. So we are hearing the same message from the entire institution, which is how it needs to be in order to be successful. So we are being held accountable to our leaders. Our leaders are holding us accountable to get this work done.
Excellent. I mean, and that's so key. Reverend Perry and Reverend Clayton, let me kind of come to you because we hear often about statistics and numbers, but even recent data from the U.S. Census and even more informatively from the Association of American Medical Colleges, the data suggests that the percentage of practicing Black physicians is much lower than would be predicted. Some have said even much lower than even 10, 15 years ago. But why is racial diversity in healthcare and research so important, Reverend Perry and Reverend Clayton? Reverend Perry?
Okay, I was waiting on my colleague.
Okay, Reverend.
Who was waiting on me.
That's all right. We can flip a coin. You know, we can flip a coin. Or...
No, I think. See, I've always stipulated that there has been inequality in institutional agencies due to systemic racism with regards to participation of minorities into the health field. Mm. And I believe that this has long-range ramifications that we're starting to basically see, maybe due to this pandemic. Mm. And now that the eyes are on minority population and marginalized people, we have to go back to the institutions and see what's going on there. For example, there was a study that showed infant mortality was greater among Black women who had white doctors than Black women who had minority doctors. So, I mean, this bigger, and the question is, now that we know this, what do we do with it? And I think that Nhinia's program really is set to address that. And I know she has a program with high school students, mentoring them for this. And I think that it's a great effort, but I think we need to expand that by great leaps and bounds if we are to deal with this inequity and if we are to change the outcomes of minorities with regard to healthcare.
Reverend Clayton?
Yes, sir. Brother Tom.
Good morning. Always good to see you.
It is good to be seen, as you say. The other problem that we have here is that the lack of participation for minorities in clinical research. It's so often that we don't participate a lot of times because we have not been informed. So I would hope that as we move in this area that we would give more information concerning clinical research. And because even though we're basically the same, there are some differences. I can use the analogy of an automobile. You couldn't take a Toyota part and put on a Chevy. But in the case of humans, we're so close, but then again, there are so many differences. And if we don't participate in the clinical research, then the medications will not be as effective and they won't be as safe for us. So this is a very important area that we need to continue to improve on.
And Dr. Janelle, Reverend Perry kind of alluded to it indirectly about that you've been involved with building people use the term inclusive workforce, but it's maximizing all the talent and I would say even all the genius that's available in the human species, where every person can bring kind of some genius to the table, but to build an inclusive workforce requires addressing many components from recruitment to retainment and beyond. But Yale's involved, again, not just issuing press conferences, but involved with some innovative programs to right here in little old New Haven, but also that could have worldwide impact to make sure the health professions includes people from various cultures. Talk to us about that.
Yeah, so it has been proven that diversity makes us stronger as a community and improves the work that we do. So all the talent. And so in the Department of Medicine, also across graduate medical education, we have several initiatives to increase the number of minorities coming to Yale. So one example is we have a student visiting program where we invite students from basically minorities like the HBCUs, the historically Black colleges and universities. We have a relationship with them, and we invite students to come to spend a month at Yale. During this month, we expose them to Yale. Some are hesitant to come to Yale, and we welcome them to Yale. And then when they're here, they have clinical responsibilities, but also they get to meet the leadership of the departments as well as the school and some of the leadership of the hospital. So that's one activity, that's one program. And that program actually, not just medicine participates, but also pediatrics, surgery, emergency medicine, and psychiatry. So it is expanding across graduate medical education. The other one is that we invite all the applicants who self-identified as underrepresented in medicine. We invite them back for a dinner. And that dinner is where they come together along with faculty and trainees who are already at Yale. So that dinner serves as another activity to say, you're welcome at Yale and we want you at Yale. Another activity that we have is that, and this relates to the climate and the culture of the institution, is that we teach on how to speak up against bias, microaggressions, and stereotype. And we carry this educational opportunity across graduate medical education as well. And the school is actually forming a collaboration with Meharry School of Medicine, bringing first-year students to participate in a research program. Again, exposing those students to what Yale has to offer. And we also do go on, prior to COVID, we visited the Meharry, Howard, and Morehouse School of Medicine to meet with the students there, where we brought faculty and residents and fellows from our programs to meet with them. And during COVID, we couldn't attend in person, but we had a lot of virtual activities also, to connect with those students. So those are some of the activities that we have. And the other one, Reverend Perry mentioned reaching out to the high school students. We have a pipeline program where we started, our first session was in March of this year, again, postponed because of COVID, where we meet with the students and parents and guardians to let them know to basically expose them to role models in medicine. And so that's one of those are a few of the activities that we have going on.
Give me some more. I mean, I like that. This is so important. I mean, you're covering from A to Z and step by step and all the various segments and categories, and how does a real village make a village? Anything else that comes to your mind? And not that that's not enough, but I mean, that's
sure. So we have held in the events of 2020 that were so horrendous. We have held this is what Dr. Gary Desir, the chair of medicine, one of the things he calls it is to continue the conversation. And so we held town hall meetings, we held workshops, we had book clubs. And so book clubs that allow people to come together and express some of the things that they may not feel they can express on their own, but they can express it through a book, because they can identify it with a story in the book. And they may say, oh, this is what I read in the book, but actually something that they want to express themselves. So we have several of those activities, and in the process of building the Office of DEI, we are going to provide faculty development on DEI to all those vice chiefs of DEI that I mentioned before, so that they can carry the same message over to those 11 sections.
And I love that you shared this. I mean, you're really leading, embedding truth and liberation and freedom in people's mind. In terms of, I love that. Dr. Perry and Reverend Clayton, Dr. Ganao has kind of indicated the need for students. I mean, you got to have bright and willing students. But how can we encourage students of color to pursue careers in research or medicine? Because no question in my mind, that's the topic moving forward for the next 50 years. Health is going to impact everything: economy, political systems, social structure, relationships, birth rates. I mean, you name it. It's clear to me that students should really be intrigued with entering this career in research and medicine, but not enough are. How can we encourage more students of color to do that, in your opinion?
Dr. Janelle mentioned one word that really stuck out. The word was exposure. And my wife was a 6th, 7th, and 8th grade science teacher. And we need to continue to encourage these young students, and at that grade level, who show some interest in science to move further. If we start them young, there's a better chance that they will take an interest in it. Take for instance, like Reverend Perry and myself. We around preachers. I was around musicians. That ended up being my life's work. And if we expose the children at a young age, that is one area I think would be powerful and productive.
Indeed. Reverend Perry?
I agree with my colleague, and I would add to it, Tom, that And one of the things that we really have to look at is institutional racism. And I say that because you can expose children early, and I think that's great and grand. But I remember in my school in Waterbury, my siblings, and my other community members, folk who look like me, were told by our guidance counselors that college was not for us. Mm. And even Judge Ferguson here in Waterbury was told that at his school here in Waterbury. And then when you apply and you see that the number of applicants who apply to schools like Yale and Harvard, the number of minority people who get accepted, I mean, Black minority, Hispanic minority, who get accepted is becoming less and less. It's becoming harder and harder to get them in these schools. So one of the things as cultural ambassadors that we have to do is we have to look at the social determinants of health in all of its ugliness and say, where do we start with this? And so it's not just one approach, but it's a number of approaches we have to take. As ambassadors, we want to not only show models, but we want to help our young people become those models that we're showing. And that's not going to happen if we can't open doors. So we're looking for the business community, we're looking for the pharmaceutical communities, we're looking for the medical communities, we're looking for our HBCU colleges to come in and help us with summer programming, with mentoring programming to help prepare and to expose our young people to the medical fields, and basically to all fields that show opportunity for us to grow. I mean, it's just not medical. We're locked out of a whole lot of fields. We've got to break down this barrier. And so we have a newsletter. We use our pulpits. We use our spheres of influence in the community with other leaders that we talk about this. NAACP right now is trying to hire minority population because they know how important that is and what this pandemic has done in terms of minority people and set us back even further in education, in employment, and in healthcare. So we really got to wipe the slate clean, start all over again, sit people at the table, just like we did when we started this pandemic. We need to start and come up with a formula that's going to work for all of us, because when it works for your minority and your disproportionate population, it also heals the greater population and works for the greater population. So it's a big task, and I'm glad we're on the show to talk about it, because, you know, Nhemia still has to deal with the institution in which she's a part of. She's just one person. We need to have, our community can put pressure on that institution. We can put some pressure on those pharmaceuticals, because we make up the population that is either affected by it the most or the ones that should be looked at in terms of how it affects the general population.
That's excellent.
And I just want to add, Tom, that we need a partnership. This work is not on the shoulders of minorities. Everyone has a responsibility to address these issues. And I want to also go back to the point of when a child says, I want to be, let's say, the president of the United States, we need to listen and we need to believe in that child. We cannot discourage the child, starting with the parents and the guardians. You need to believe and encourage that child to pursue those dreams. And going back to the word of exposing, like in medicine, it's not just doctors. There's so many opportunities in medicine for the youth to engage in and to aspire to. And when let's say in the schools, and also us as role models, we need to show them the way. It's not enough. The parents may not know the way. So sometimes it's us. We need to show them the way to get to achieve their dreams. And that's how we're going to get more and more of the youth interested in careers that at the time may not seem achievable.
Indeed. And you know, Dr. Janelle, elaborate a little bit more, because I mean, you've in addition to your institutional responsibilities, your group and organizational responsibilities, during this past Black History Month, you championed a message, if I have it correctly, if I made it, you can make it too. And that's not to say that everybody is going to achieve the same, but still just inspiring folks collectively. So tell us about that. If I made it, you can make it too. I love that.
Yes, and the message that I want to deliver with that is that I come from such a humble background. And I publish on this because I want people to know where I came from, what I have achieved. I can tell you, Tom, that there were times that I had to walk with one hand on my hip just to keep my underwear from falling when I was a little girl, because I only had two of them. And so I experienced illness, I experienced hunger, I experienced so many barriers. And so I feel that if I made it, you can make it too. And so it requires determination. It requires a support system. You know, that you asking for help is not a sign of weakness, it's a sign of strength. So encourage the youth to ask for help. And we as leaders in this field need to be responsible for that.
Indeed. And Reverend Clayton and Reverend Perry, just elaborate on that, because I hear the word mentorship emanating from Dr. Janeo's previous comment. So just to drive that point home a little bit more emphatically.
Well, Tom, I think there is a kind of hopelessness and despair within a community based on racism, if I can just be direct. So if even if you had aspirations to be something, you've already been marginalized. You've already have the feeling of no self-worth. And it's kind of hard to pass something on to somebody else when every day you're just trying to put bread on the table and a roof over their heads. It's really hard to say, I need you to go to college. I need you to, if you aspire to be a doctor, I'm here to help you, because we're just, minority populations are really trying to survive. I think that, the way that we do this is also by example. If schools want this message, then put some money behind the wording. If you really are looking to do this, show us how many minority students you're bringing in every year. Men, women, Black, Hispanic. Show us that you're putting your foot forward. Don't tell me that you're just doing this for doctors who already have been positioned in the school, and now you're gonna teach them how to handle minorities. That makes no sense to me. Show me that you can bring a number of Black people in. Show me that you can start messaging, streaming during these commercials when we watch the news. This is how many people Yale or Harvard or whoever is taken in terms of minority population. This dream is open to you because we have summer camps and summer schools. This is not some utopian idea, but this is an idea that's real, and we are invested in this idea. And until we do that in this capitalistic system, until we do that in this racist system, we're not going to change anything. I know I'm preaching to the choir, but I got to say it because I am a preacher.
I missed yesterday, so I'm glad you kind of brought me up to that speed today. And the good news is a 24/7, 365 experience. Dr. Gano, even in terms of what Reverend Perry has mentioned, I'd be remiss not to give you the opportunity to talk about some of the things that the profession, I'm going to say your profession, but the medical profession has done during this pandemic to address the inequities that preceded, and hopefully we can diminish moving forward. But what are some of the things your profession has done during this pandemic to address the inequities that lead to the different outcomes among groups of people?
Sure. And one thing that I would like to say before I answer your question directly, Tom, is that COVID-19 is like, sometimes we blame COVID-19 for disproportionately affecting our communities, but it's not just COVID-19, it's the underlying problem with the social determinants of health. So like where you start from matters. Like some of the things that we as a healthcare organization, and also the messaging from the CDC and so forth, in terms of social distancing and washing hands and wearing masks. Well, if you're not able to social distance and you don't have access to masks, if you have to work 2 jobs and take public transportation, is a lot different than if you are able to drive your car or work from home because you have all the conveniences of that. So I think that the social determinants of health are the ones that have to be addressed in order for us to come out from this, from under, actually. And so organizations have been doing a lot of education on how to stay safe from this virus, but also going back to Reverend Perry's comment on racism, because it is real. Organizations have been putting dollars behind their messaging to combat inequalities and racism. So it's not just, sending out a message, but there has to be resources, money behind it to do this work, including research in the areas of racism and inequalities.
Excellent, excellent. Let's move a little bit to vaccine hesitancy. I won't even share my opinion because it kind of aggravates people. So let me just keep my mouth shut. But there is that lack of trust and just hesitance, if you will, in terms of. But how is the medical profession, in your mind, Dr. Janot, addressing this reluctance to treat one another as you would like to be treated?
I think we have to admit the errors that we have made, and we have to come clean. We have to say we made mistakes. We did not treat you fairly. We have to admit that we were racist, and so and we discriminated, and we did not treat people equally. So that has to be at the forefront. And that's one thing that we need to be transparent about. In addition, we also have to be transparent with the work that we're doing on these vaccines, for example, in educating the public and being the role model. We are the ones, in this case of COVID vaccines, I think we in the healthcare community were role models in terms of that we were the ones that got vaccinated first. And so if we show that example, it's an example to say the vaccine is important because we're vaccinated the entire healthcare community that is supposed to take care of you. And so it's a saying this is important and it is safe to do so.
I mean, that's excellent. Let me drill down, Reverend Perry and Reverend Clayton, on what Dr. Janot has mentioned about the cultural ambassadors. Historically, for over a decade, have partnered with researchers and physicians to improve messaging, regardless of what the topic might be. I mean, there's been so many important topics. But what should be the focus of messaging around the vaccines, especially now, given the eligibility is down to 12 years old? So what's the cultural ambassador's role in this regard in terms of helping improve messaging? Reverend Perry?
Tom, you can't take 300 years and try to expect that you can change through just a year, the message that has been indelibly been put on the minds of African Americans. One of the ways I think is through education, but not just education in terms of messaging. But what Black people must learn to, or should know, or we could help them to know, is that medicine in America built on the backs of African Americans. I'm talking about from the grave diggers, to the plutonium studies, to the prison studies, to the medical apartheid that Harriet Washington talks about in her book, when a slave could walk into town, come back with missing a limb or an arm or a leg because he was property, that doctors could examine Black women without anesthesia, do what they wanted with them so that they could learn how to do gynecology and become famous for it, and give no credit to the African Americans. And so it just seems to me that part of the messaging is that we've got to tell the truth. Part of the messaging is not just the Henrietta Lacks study or the Tuskegee study. I think Black people are just suspicious of a medical community that does not seem to care about their care because they're marginalized. Do you have insurance? Well, I'm going to spend 2 minutes with you while the person who has got the insurance that covers me, I'm going to spend 30 minutes. I'm not going to ask you because I don't understand your culture. So there's the implied bias that goes on with white doctors and Black patients that no one is the elephant in the room. So it just seems to me that in order for the messaging to change is that we've got to reach young people. We've got to start talking about how research can advance better health for African Americans and marginalized people, as it has done for other races of people in America. And we have to get this message out. You're not the guinea pig. You're the person that may need this information more than the others because they've already understood this. It's like somebody said to me, if I saw a line of only Black people getting vaccinated, I would be suspicious. But when you're a Black person and you look at a line and you see one or two of us, you should say, maybe I need to get in that line. Maybe that ought to be the message.
Reverend Clayton or Dr. Janelle?
Yes, Tom. You were asking a little bit earlier about vaccine hesitancy and the message that we should have for especially those that are 12 and years old and up. The message should be, we got to save the children. According to the American Academy of Pediatrics, over 3 million young people were diagnosed with COVID-19. About 300 of those children have died. So that's a great number when you're talking about losing young people. So I want to simply say, let's get vaccinated so that you young people can get back to school. Get vaccinated so you can play the games you love to play, soccer, basketball, etc. Get vaccinated so that you can hug your parents and your grandparents. Get vaccinated so that you can travel again. Get vaccinated for the people that you love. Get vaccinated because the vaccine is really safe and it's effective and it will save lives.
I'm tempted to end the show right now, but don't.
I agree 100%.
But we got another 20 minutes. Let's soldier on. But that's just, I mean, that we want to take that away with us. Ingenia, you want to comment on that? I mean, that was just so profound.
No, I would say that is, I agree 100% with that. We need to get vaccinated for the future, And I like what Reverend Perry said about the line, that if COVID did not discriminate. COVID affected all of us. And so if you see that line and you're not on that line, you better get on that line to get vaccinated.
Any thoughts about the CDC mask mandate? I mean, it seems in the last week we've heard so much in terms of relaxing, and then governors and people and organizations having one point of view. Any thoughts about the CDC messaging that we're going to have to still undergo?
I would say for that, I find it personally a little bit premature because we are still, it took us a while to convince people that this was the way to get vaccinated, to prevent the virus. I mean, and now it's not like we have reached that core number of people to get vaccinated. So until then, I feel like we need to continue with all the precautions until we have vaccinated a significant number of the U.S. citizens.
Excellent. Ingenia, I want to move to. And for people that I've talked to before from the Yale medical community, all of you are published and you're almost not mandated to do research or to write, but many of you do, and it's really a joy to read some of your writings. But there's an article that you recently co-authored, and I think this kind of relates a little bit to Dr. Perry's comment that we have to saturate and influence every segment of our knowledge society, from PhDs to the no-Ds to from the A to Z. So the Journal of General Internal Medicine, you co-authored an article, a roadmap for diversity in medicine during the age of COVID-19 and George Floyd. So, I mean, that's a mouthful, a roadmap for diversity in medicine during the age of COVID-19 and George Floyd. And you speak about the legacy of discrimination, but you not only just speak about it, but you offer up some solutions. And I think that's the key that I'm really excited about this show. Share with us some of the recommendations you mentioned. I read them last night, and they were profound. I mean, they impacted the pocketbook, institutional pocketbook.
Yes.
So tell us about some of these recommendations and take your time in doing so.
Sure. So I'm thinking that it's not enough just to mention the problem. We also have to make recommendations and we have to take action. Our hope is that institutions around the U.S. would read our article and take actions on those recommendations. And some have done. Some have done so. So, for example, I mentioned before, one of the things institutions need to do is to admit the errors that they have made, that they have been racist, and that people have been at a disadvantage because of that, because of racism. So that has to be clear, and we have to name it for what it is. The other one is that the institutions have to commit resources. It's not enough just to send out an email message that goes across all the faculty, staff, and trainees to say, we're really sorry for what is happening in our country. That is not enough. We have to take action. And action means resources. Action means looking at the budget and including DEI and anti-racism funding in that budget. And it's not just, we cannot just be reactive to, let's say, what happened in 2020 and what continues to happen in 2021. We have to think ahead and create programs that are going to address the continued issues that we're facing. The other one is, we have been mentioning here that there is a discordance in the care provided when there is a race discordance, meaning, let's say, a Black patient being cared by a white physician. So one way to remediate that is that we need to increase the diversity of physicians and other healthcare providers in medicine. We need to increase the workforce. We need to diversify the workforce in order for us to address those discordance. And those are, the other one is that in addition to the care provided is that patients, the experience that patients have when they see a physician that they can relate to, they're more likely to comply with the recommendations from the physicians, and there is an increased trust that is quite important. So our recommendations, I'm hoping that our recommendations will be taken very seriously by the institutions and commit resources to addressing racism and other types of discriminations.
And tell us about your co-author, who you co-authored. Tell us about him or her.
Also, is Darwin Boatwright. So Darwin Boatwright is one of our colleagues in emergency medicine, and he does a lot of research related to health disparities and racism.
And I mention that because oftentimes we think that we have to row, we have to kind of be the great man or the great woman theory, but no, I mean, it's really the great collaboration that's going to be key. What's next on your thought in terms of your next article that you might be publishing?
So I'm actually taking a sabbatical starting in July. And that's basically protected time. I'm explaining for the audience, is protected time where I'm not clinically active so that I can have time to reflect. And what I would like to do is I would like to write a collection of articles on how to increase the physician workforce from the diversity standpoint.
Really topical here, definitely. Reverend Perry and Reverend Clayton, we have about 10 minutes or so to kind of freelance and kind of wind down. But I guess before I do that, and Jeannie, I guess want to mention also that you had a recent, as Reverend Perry indicated, about the pipeline and the admissions, et cetera, and the whole process. But you recently had an event where I believe over 350 participants on a recruitment dinner for future potential folks. You mentioned the dinner, but kind of elaborate on that as more, because I'm thinking even now with the virtual thing that will probably remain with us even after we can see eyeball to eyeball to one another. You might even be able to expand these ways of recruitment.
Yes. So prior to COVID, we have been holding this event for the last 4 years. And prior to COVID, what we did was, this event is resourced by both the hospital and the School of Medicine. And we provided those trainees who were interviewed at Yale and were self-identified as URIM or underrepresented in medicine. We provided them with a travel assistance so that we did not want that to be a barrier for them to come for this second look, we call it. We also provided hotel accommodations to those individuals. And this year, because of COVID, it was held virtual. And I think the virtual aspect led to more medical students applying to residency programs. That was one. And also the virtual aspect facilitated people participating because, it was easier to do so. So we had over 300. But also to this event, we invited the dean of our school, Nancy Brown. We invited the president of our hospital, Keith Churchwell, Tambo Cesac, the chief of staff, and other leaders from both of the institutions came to that event to welcome those applicants. And I want to say, I'm very happy to say that over 60% of those applicants who came to the dinner came to Yale. They're coming in June to start internship.
We have to welcome them. Tremendous.
Yes, yes.
Who's going to keep the ship of state afloat while you're on your sabbatical?
Also, so you see, this is so I'm going on sabbatical. So my clinical responsibility will be covered, but I will continue with my leadership roles while I'm on sabbatical.
Tremendous.
Yes.
Tremendous. Reverend Perry, Reverend Clayton, as we have like about 10 minutes or so, 8 or 9 minutes to kind of just share and reflect. I mean, we've covered the landscape as what has to happen, and we certainly have shared examples of what is happening from a structural and infrastructure standpoint.
Tom, I think that what Najimia is saying is so relevant to all of us. And I think the idea is shows like this show and other shows and other forms of media, be able to get the message to the people who are at the bottom is so important. If you're already at the top, you can get this. It's like when someone handed me a newsletter from Yale, I looked at it, I looked at the pictures first. I didn't see anyone who looked like me. I was ready to set it back on the coffee table. When I can see information like this and with people of color as part of the focus, then it makes me want to read. And that's the way we need that bridge from the institution to the community to get this message across to as many people as possible. And that's one of the efforts we're trying to do. We've got Jackie and others working on our newsletter, but we want to produce more of the newsletters, put more articles in and links to this show and shows that that Yale may have that deals with diversity and equity, and so that we can, maybe other institutions and other businesses will see that and the partnership will grow, and we can attack this like we attack cancer from all different areas. And I think that's the only way we're going to be successful. I mean, we'll have minimal success, but we'll have greater success if we are collaborating together, working together to change the outcomes.
Reverend Clayton? I'm sorry, Ingenia?
No, I was just going to say, add to that one angle that we can tackle this is by looking at those with privilege. Those with privilege have a responsibility to give up some of that privilege so that others can benefit. For example, if a position comes, if there is a recruitment for a position, if you're already at the top, you don't have to apply. Let some of the people apply so that they have the opportunity. When you get invited to committees, demand that there is diversity at that table. And if you are at the table, ensure that the diverse representatives at the table have a voice. Because sometimes you get invited to committees just because of the way you look, but not because there is intent of actually being included.
Reverend Clayton?
Yes, I would like to take a little personal privilege to just say that to thank Dr. Janelle for being so warm and so informative for us today. And with all that's on her plate, a year ago, when we could not get face coverings and masks, she was one of the main persons who saw to it that we were able to get great numbers. And she was willing to deliver them. Not only I'll come pick them up, but, well, I can do this, but that shows us the type of person that we're working with, and who's willing to not only give her knowledge, but her time in areas where it's not actually necessary for her to do so. So I want to say to you, thank you so much for all of your efforts.
Oh, thank you. Thank you for the opportunity to serve. Thank you.
And Gina, this might not be the best question to ask you in terms of your expertise, but I'm wondering, even because you've been in the field, when did you decide that you wanted to enter the medical profession? When you were 6 or 7 or 8 or 9, or do you have a recollection?
So if you read my story, you will know that it's as far as I can remember. I always wanted to be a doctor. There was no, I can't recall not wanting to be a doctor.
That's your calling. Would you have any advice for a parent? In other words, if you observe a 4-year-old or an 8-year-old or a 10-year-old, and you observe them for the day in school, could you detect if they might be interested in math and science? I'm just curious how your mind works when you look at the younger generations.
Sure. So I can tell you that when I see the parents and they bring their kids to the office, they sometimes they want to play with my stethoscope. And I clean it up, and I'm like, yes, you can hold it. You can see what it feels like. Do you want to listen to the heart? So like, if you make it playful for the kids. And some of the kids will say, I want to be a doctor, and this is saying, yes, you can be a doctor too. You can be like me if you want to. And so it is that I would say believing in those kids, like I said before. And the other, I think it was a couple of weeks ago, I was sharing my story with a group of high school students from New York, and you can see how some of the kids already distinguish themselves because they tell you they want to do medicine, but there are things that they do, like sending you a message saying with a question. That's already taking advantage of an opportunity to get connected. So I would say for the youth out there, a career in medicine, as I said, it doesn't have to be physician. A career in medicine is so rewarding. It's such a privilege to be a provider, to be a doctor, to care for our community. It's also very versatile. As a doctor, I don't only see patients. I have these leadership roles that you mentioned. You could do research. You could work for a pharmaceutical company. You could be in private practice in the community, seeing patients. So it allows you to do so many different things. It opens so many doors. And I have not seen a doctor who is unemployed because of unemployment. So it also offers job security.
Let's Harry, the station manager, he'll play the music, and that'll be the clue that will be kicked off. We have about another 2 minutes or so, but want to kind of give everybody 90 seconds or so for kind of closing remarks. And it's such a joy for it to feel the warmth, not only the warmth, but the passion and the commitment of all three of you. So I personally appreciate that. Reverend Clayton, you'd like to give us some closing remarks?
Yes. Just remember that if we want our health care facilities and anything that's dealing with science to be better, it will be far better with all of us instead of just some of us.
Reverend Perry?
Yes, I just want to thank again our guests, and Himya, and to Reverend Clayton for his astuteness. I really appreciate him. He's my co-partner. I always look for him, and when he mentioned that mass, I had mine ready to go. I think that this is a wonderful opportunity that we're sharing with our community and the community at large. And I'm just hoping that more people will see it and learn from it, and maybe partner with us in this larger task that we're seeking to achieve. So my hats are off to you, Tom, and to everyone on this show, because I think we've made we started a pipeline, so to say, here
Yes.
today, a pathway here today, and I'm elated at what we've done today.
And Jane, last words, and even if there's any, you've referenced some people, Dean Brown and others, but if you want to share some of the other I won't say co-conspirators, the fellow abolitionists that are working with you in this regard.
Sure. No. So I would, my message to our community is to don't hesitate to ask for help and demand at times what is yours. That's one thing. And I have many collaborators, my goodness. So Steve Hewitt is the director of graduate medical education. So I work very closely with him. Gary Desir, I think, Tom, you know him. He actually sends his regards. Right. He's the chair of medicine. Dean Brown, the dean, Darren Lattimore, the deputy dean for diversity, equity, and inclusion, and Tom Bosesak, the chief diversity, the chief of staff on the hospital side, Keith Churchwell. I mean, it's just so many people that I work with that without them I couldn't do this work.
And we would mention Tisha Johnson Harris.
Yes.
Not avoiding myself and feeling what's missing. Better watch the way you going. Better go in the right direction. In the moment you stressing, but you gonna be counting blessings. And I know that for certain. Keep on working, open curtains. Haters swerving, cause they ain't ready for your final version. Whoa. I'm never gonna give up. Fall down, I just gotta get up, yeah. Cause this is my road. Lights, camera, action, I'm ready to go. I'm never gonna give up. Fall down, I just gotta get up, yeah. Yeah, this is my road. Lights, camera, action, I'm ready.